it's Dr. Marquez here, your local chiropractor at the Back Pain Relief Center. I'm here with my sister today, my sister Joann, and she hurt her back, her mid-back. And she's in so much pain that she was having difficulty standing there. She wasn't sure if she could lay down. This pain is of an unknown cause. I'm not sure really what brought it on. What she's describing to me is a disc issue or disc problem right in her mid to low back. So when patients come in, a lot of times they're very worried about getting treated or getting cracked or manipulated because they think it may increase her pain. So what we're going to do with her first is I have some pelvic blocks on her to relieve some pressure on her low back. We're using a TENS unit right on the area of pain along with some ice. And we're going to do that for a good 15 minutes to try to get the inflammation down, and then we'll revisit the idea of trying to manipulate that area or do some soft tissue area to relieve some of her pain. After we ice this for a little bit, we'll come back and show you the rest of the treatment. Okay, we're back with Joann, and what we did was we stemmed, so we used a TENS unit and ice pack on her mid-back for a good 15 minutes. How you feeling while you're laying there? Any pain while you lay there?
No.
So a lot of times when we lay patients down like this and we put the blocks in and we do that, it takes the pressure off that disc and begins to get some inflammation down. Now, ideally, if I was in a hospital situation, I'd make her lay here for an hour to really try to get it to go down, but we're in the real world, we can't do that. The next thing we're going to try to do is some myofascial release or some muscle work there to try to relieve a little pressure. We're going to attempt to use an adjusting instrument and then possibly a spinal manipulation. That hurt? How about more on the outside? We're really going to use this for a minute or so here just to try to loosen these muscles up. A lot of times when the disc or the nerve is affected or pinched, these muscles will really lock up, trying to protect that area. Tender? All right, we're going to try a very gentle manipulation. Okay, go ahead. Deep breath for me. And just breathe all out. Really light, really light. That's all. There it goes. So we got a little bit of movement in that joint. Now, with patients like this where they're in such pain, what we're going to do is refer her to a medical doctor or one that we have a good relationship with to try to get her some medication. Typically, they'll prescribe a strong anti-inflammatory or whatever they deem appropriate for your care, but this is an inflammatory process. The inflammation needs to get down, and that will help in the recovery or speed up the recovery. We're going to pull the blocks out. Might feel a little bit of pain when we pull it out. I want you to roll to your side, and then I'm going to help you up.
This way?
Whichever side you can at this point. And try not to push yourself up. I'm going to lift you up. Okay, good. Okay, can you give me that bottom arm? Good. Okay, put this arm around my neck. I'm going to bring it a little closer to me, and then up. Painful.
Oh, yes.
Nice deep breath. I want you to spin around and face this way. Hurt while you're sitting there. That's no good, huh?
Wow.
I'm not sure if we're going to be able to do this next one. I don't think we're going to be able to handle it, but we're going to try it.
Okay.
All right, so I'm going to cross your arms and chin down to your chest. I'm going to try to lay you back and pick you up, but if it's too much, you'll know right away if it's too much. You're going to tell me it's too much.
Okay.
All right. Keep your chin to your chest. Don't let your chin go back. Good. Good. Good.
Oh.
There we go. Good. Good, good, good.
Across my arms.
You going across your arms? So that went well. and manipulate. That's a good sign.
Yes.
If I brought you back and it didn't, then it's not a good sign.
It's just right here.
You know, so you stand up for me. Put my hands. Come on up. Still in pain. Okay. All right, so guys, we're gonna follow up with some future visits and see how she's doing. All right, guys, I'm here with my sister Joann. We had a video yesterday. She was in quite a bit of pain, very antalgic, hard to even just stand there. We did one manipulation and one treatment, and are you feeling just a little better?
Yes.
Okay, so we're not 100% yet, but we're feeling better, so we're going to deliver another treatment today. Let's go face down. Still on that outside pork?
Yeah.
How many times did you ice it?
Oh, no. Every 15 minutes on and 15 minutes off.
So a big thing we had Joann do was ice at home, 15 minutes on, 15 or 20 minutes off. She did that a bunch, and I think that's a huge part in the recovery of spinal pain. Before we got her on here, we already did some electric stim on her. We did some ice. Right now we're using a massager just to get a myofascial release, loosen the muscles up a little more so this adjustment goes easier. Come on up for me. So that's up much easier than yesterday.
Yes.
Spin around and face that way. So if you watch the video yesterday, she could barely get up, so much better already. Here. Okay, chin down. I'm gonna go right here. Good. All right. Good stuff. Hurts just a little bit when we do it, right?
Yeah,
But it makes
just
it
a
feel
little.
better a little later. Now we're going to put her on the roller bed, loosen up the back just a little more, and we'll probably see her one more time next week.